Hello, it's Dr. Sean McCorkle again here at Summer Creek Animal Clinic, and today we're going to talk about oral hygiene in your pets. And so we've talked about addressing disease in the mouth, doing a professional dental procedure, but after that's done, or if we have a young pet that still has a healthy mouth, it's really important that we focus on at-home oral hygiene so that we can try our best to keep the mouth as healthy as possible. So even after a really detailed dental procedure, the plaque or the bacteria starts to adhere to the teeth pretty immediately afterwards. Just like in our mouths, we have to brush our teeth twice a day because that plaque builds up so quickly. It's very similar in our pets. And so when we're talking about at-home oral hygiene, we're talking about things you can do to try to reduce that plaque and tartar buildup and hopefully slow or prevent the progression of disease moving forward. In doing that, in combination with good, thorough dental procedures or comprehensive oral health assessment and treatments in your pet, doing that regularly will help give us the best chance of providing a healthy mouth long term. And so we want to talk about a few of those methods for you to do at home and give you some ideas on that. And then in a future video, we'll do a demonstration of teeth brushing. So the first and most important thing to talk about with oral hygiene at home is, of course, the most difficult thing, which is regular daily teeth brushing. That's the reason why we do it as people, is because it is the most effective thing at physically removing the plaque buildup. And it's the same thing in our pets. So by far the best thing, also by far the most difficult thing. It's really important to understand on the teeth brushing that it has to be something that's positive, and you take your time getting your pet used to it, making sure that there's a lot of positive experiences anytime they see the toothbrush, anytime you're handling their mouth, and taking a very slow approach to it so that we don't have a real negative experience as soon as you jump in and start trying to brush your pet's mouth, which we will discuss more when we do the demonstration. So teeth brushing, by far the most important. It's really important to understand that with teeth brushing, it has to be good teeth brushing. So being able to brush really the outside of the teeth. Brushing the inside of the teeth is really pretty much impossible. If you can brush the outside really good along the gum line of every tooth and do it daily or as close to daily as possible, that's when you're going to see the most success. Some additional things that you can do that what I would recommend in addition to brushing, but if you can't do brushing, then a combination of these other things are broken up into some different categories. The main one is going to be things that your pet chews on. So in a dog, we have some great products. One of them is called Oravet. This is a softer treat. If you're familiar with greenies, it's going to be similar in texture, but the reason why this is better than a greenie is because it has an additional ingredient in it that is a plaque repellent. So as your dog chews on it over the course of 30 to 60 seconds, that ingredient gets into the saliva and coats the teeth in the mouth, providing just an added plaque repellent. And so giving one of these daily can be very helpful. There's a lot of different rawhide type products out there. I know a lot of people are weary about the variety, and some of them can be a hazard. So we do have to be careful with them. But this one in particular, called Breakables, I really like because you get the rawhide texture. It takes them a little bit longer to chew it up, but as they chew on it, it breaks into smaller pieces. So it becomes less of a choking hazard, doesn't get soggy, and they're highly digestible. So it ends up being a really nice product for that. And then the other products are going to be things like rinses, chlorhexidine rinses, water additives. Generally speaking, those don't tend to work too well. And so I really like to focus on the things that are physically removing the plaque, like the chews and the teeth brushing.